There is a new illness spreading around the world called COVID-19. It is caused by a coronavirus. Viruses are tiny particles, much too small to see, which spread from person to person. There are no medicines to cure COVID-19. While most people recover, some people get very sick and die, which is why we all need to help to stop the virus from spreading. The new coronavirus is very infectious. A person with it can spray millions of viruses when they cough or sneeze. This is why we need to stay a bed length apart from each other. The virus can stay on doors, taps, and other objects for several days. If you touch them and then touch your mouth, nose, and eyes, you can catch it. That's why you need to wash your hands with soap for 20 seconds. Find alternative ways of greeting from shaking hands, and if you cough or sneeze, use a tissue or catch it with your elbow. Do not spit. If an infected person passes it on to 3 others, who then each pass it on to 3 more, in a few days, a whole village can be sick. If someone knows they have the symptoms, they and their family should stay at home so we can slow the spread of this virus. The symptoms of this coronavirus include cough and fever, headaches, body aches, chest pains, and tiredness. Some people lose their sense of taste and smell. Many people only get 1 or 2 symptoms and are not very ill. They might not even realize they are infected, but they can infect others who might die. Some people get lots of symptoms. If they then get trouble breathing, this is a dangerous symptom and requires immediate expert medical advice, particularly if they are in a group that is at higher risk of dying. The illness becomes more serious with age. So someone who is 50 is much more likely to become seriously ill than someone who is 20. Those at higher risk of dying include people over 60 and people with medical problems like diabetes, high blood pressure, heart problems, or untreated HIV. People with HIV who are taking their medicines and do not have other conditions are not thought to be at high risk. If those at risk can sleep and eat separately from other people, this may prevent them from getting sick and save their lives. It is rare for young people and children to get seriously ill, but they can pass on the virus, which may kill elderly parents, grandparents, or friends who have other health problems. If you are in a lockdown or self-isolating and one person has to go out to collect food or to work, they should be extra careful. Outside, they must keep 2 meters physical distance from others and try to avoid touching their face. They can use a mask outside the house. Masks made of cloth must be washed frequently. On return, before entering the house, they should wash their hands and remove and wash their mask. They should wipe plastic bags or other objects they bring into the house with water mixed with bleach if available or detergent if not. Because some people do not get symptoms, it is impossible to know who has the virus and who might be spreading it. It can be difficult to stay apart from people, but this is the best way to stop the spread of the virus. Try to keep your house well ventilated. Please wash your hands regularly and remember to keep a bed length apart from people. Remember, if someone in your home is unwell, you should stay at home. Thank you. This will help save the lives of people we love.